University Hospital in Coventry, the air ambulance helicopter is landing. Their patient is a 41-year-old mother who's been kicked by a horse. Dr. Nikki Williams is leading the emergency team, who is standing by as Suzanne arrives.
Hello, this is Suzanne. So her main injuries are head injury. A little bit of concern is her hypotension.
Yeah.
We're unsure why that is.
Yeah. Okay. Hi, Suzanne.
Hello.
I'm Dr. Williams. It sounds like you had maybe a little bit of a funny turn after the injury. Do you remember feeling a bit faint and unwell afterwards? Yeah. Okay.
Suzanne was at a gymkhana with her 9-year-old daughter Jessica when the accident happened. She was almost unconscious when the air ambulance arrived, and her blood pressure is very low.
Do you have any neck pain at all at the moment?
No, none.
Suzanne's head has taken a severe blow, so Dr. Williams has to be sure her neck is not broken.
That's a little bit.
Only slightly tender, right in the middle of your... okay.
Yeah.
And the gash on Suzanne's scalp was bleeding profusely.
Was that where it was sore, just there?
Out
There, yeah. And was it just one blow to your head, as far as you can remember?
Only reared up and came down on
Okay,
my head.
on your head, yeah.
I
Okay.
wasn't knocked out, though.
No, okay. We'll get your neck x-rayed first. We can get a proper look at your head then. She was trying to take a photo of a horse, and the horse reared up, and I think his hoof came down, just hit her on top of the head. She had a funny turn at the scene. It sounds like probably she was panicking and hyperventilating, and she's got a slightly sore neck with a little bit of tenderness in the back of her C-spine.
Tenderness in the neck could be bruising, but it might be a much more dangerous bone crack. It needs to be checked. The news is good.
Neck looks all right. We're going to wish you through the scanner just to look at your head, make sure you've not got any fractures to your skull.
Dr. Williams then sends Suzanne for the more detailed CT scan.
The cervical spine X-ray I thought was normal. The reason I'm doing a CT scan of her head is because she's had enough trauma to cause a fracture. If there's a fracture, there's a much higher risk of having an intracranial bleed or a contusion to the brain. It's just because of the mechanism of injury, she's at high risk of having a skull fracture, and I'll be happy if I see a normal CT scan.
In the children's area of A&E, Dr. Bisha Langbam is on duty. His next patient is 3-year-old Scott Clark, who's here with his mother, Sarah.
We're here today because Scott's decided to hurt all his fingers and we don't know how he's done it. We was playing out the front and he's got a load of blisters and I've popped them and it's gone really infected and it was like covered in gunge and it was really horrible. He says it's really sore and he doesn't want anyone to touch it. But it's just a typical 3-year-old boy just into everything. Aren't you?
Yeah.
Dr. Langbam needs to have a close look at Scott's hand.
Can I have a look at your poorly finger? Yeah. Oh, right. That's quite swollen as well, isn't it?
Yeah.
I'm not happy with those blisters. They're infected. Okay. To me, it's quite concerning because you've got the tendons in your fingers.
Yeah.
And you can get infected. Anytime, any blisters, don't break it. Because once you break it, then it's open. Then the bugs they can go inside and they can cause infection.
Bacteria probably got in when Scott's blisters were pricked, causing a condition called cellulitis. Dr. Langbam takes it very seriously.
What we're worried about at the moment is you got tendons called the flexor tendons, the one that bends your fingers, and you can have infection to those tendons. You can have loss of function of the flexor tendons, which means you'll not be able to grasp your finger or you wouldn't be able to bend that fingers.
The news is a shock to Scott's mum, Sarah.
No, it's not what I expected. I was hoping they'd just turn around and say, oh, it's just an infection, give him some antibiotics and send him home. But it's got serious more than that.
Scott's going to need intravenous antibiotics to combat the bacteria as quickly as possible. But first, he's off for an X-ray. Over in the CT scanner, Dr. Nikki Williams has been worried about Suzanne McLeod's skull after her horse accident. It's important to see if there's any bleeding on the brain.
CT scan looks all right. So we'll get her back into resus and we'll take the collar off, sit her up, look at her head, and we'll probably need cleaning and maybe a couple of stitches. Okay, but it's good news. Okay, so we can get all this clobber off you now. Be glad to know. Okay, the CT scan was fine. There's no fracture of your skull and your brain looks normal. You'll be glad to know. I think probably I'll leave you with Michelle to probably get a bowl of soapy water and give it a good clean because it's difficult to see what's under there at the moment. It's all matted.
Yeah.
But there's obviously some sort of cut there, and depending on how deep it is, it might need a couple of stitches. You might get away with glue sometimes.
It's a really deep wound, so it's that long. Where the horse has kicked you, it's taken away some of your hair as well. It is going to need a couple of stitches, I'm afraid.
Suzanne hates needles.
You okay?
Yeah, I'd say I'm just a wimp with...
Do you want me to hold off for a minute?
No, you're okay, carry on.
Horse-inflicted injuries, we do actually get a fair few. Some of them potentially can be very serious. We've certainly had a couple of people who've had, ruptured internal organs from being kicked by horses. I mean, she's been quite lucky, I think, and she's anxious and concerned because, she thinks it's going to hurt to have it stitched, and it will be a little bit sore, but it won't. It's never as bad as they think it's going to be.
Suzanne's husband Neil is by her bedside as nurse Michelle Simbo begins the stitching.
You'll probably just feel tugging, sweetheart, all right?
Hello.
Hello.
Hi, you're Suzanne's husband?
Yes.
Hi, I'm Dr. Williams. I was looking after your wife when she came in. Okay. She's absolutely fine.
Good.
Okay. The most important things to look out for are increasingly severe headache despite painkillers, vomiting, or if her conscious level is altered in any way. So if she becomes irritable or she becomes increasingly drowsy. Okay. He's smiling at you there.
That's both really, isn't it?
Yes. OK, then you need to bring her back.
OK.
OK, but it's very unlikely she'll have more than just a bad headache for a couple of days.
Are you all right? That's fine. 1, 2, 3, 4. Got away with 4 to that.
Although still shaky, Suzanne is well enough to go home with her family. Three-year-old Scott has been to X-ray so his infected hand can be checked for broken bones.
This is Scott's left hand. It's a normal-looking bone for a 3-year-old boy. I'm happy with that. Next, what we're going to do is we're going to put a needle into his arm, into his back of his hand, and start some antibiotics through it. And then we'll see how it goes tomorrow. The orthopedic doctors will follow it up tomorrow. Hello, Scott.
This is my spotty one.
Are you cooking?
No, we're feeding dinosaurs.
Getting a needle into a 3-year-old's hand is a tricky business.
They're all waiting to be fed.
Scott will need lots of distraction.
Okay, sounds good for me.
Injecting the antibiotics straight into a vein gives the best chance of rapidly reducing the infection.
We are done. Okay. Are they all hungry then, Scott?
Scott, look.
Are the dinosaurs really hungry?
Scott.
You are very brave.
Tell the doctor to be careful.
The antibiotics should get rid of Scott's infection, and Dr. Langbam has clear advice on how to avoid it happening again.
Do not break the blister. Let it heal by itself. If you're really worried, see a doctor. If there's no doctors around, middle of a desert, then if you're going to break it, make it clean and make sure it remains clean.
Scott's feeling better already, and his grandma, who's a nurse, has come to see him.
I knew he had a poorly finger, but I didn't realise just how bad it was. Obviously, it's got worse overnight, because it's all infected, isn't it? And he's proud of you. Yes.
He's not happy now he's got my mum. He knows now that someone else is here to understand what he's saying. He hasn't got to just stick up with me.
Bye-bye, everybody.
A week later, Scott has a checkup. Happily, the infection has cleared, and his hand is as good as new. A few weeks ago, Suzanne MacLeod was kicked in the head by a horse. She's now fully recovered and happy to be back with the family pony.
Absolutely fine now. After the accident, I was a bit sort of groggy for the first week or few days anyway, but absolutely fine now.
Immediately after being kicked, Suzanne managed to call husband Neil for help, but she couldn't say much.
Of course, when you get a call from your wife and there's been an accident, you always think the worst. And all I had was, it's been an accident, it's a head injury. Can you get here as quickly as you can?
Want to come round again?
9-year-old Jessica was in a jumping competition that afternoon, so when he arrived, Neil thought she was the casualty.
Well done, good girl.
And then I saw my daughter running down the field from another direction. And I thought, oh, she's recovered quickly. So I went up to meet my daughter, and she said, this way, it's Mummy, she's been hit in the head.
I remember the air ambulance coming into land, and everything's a bit of a blur, really. I can't remember anything too clearly. I remember opening my eyes once and just seeing the blue sky I just remember it being very, very fast. Felt very fast. I felt low to the ground as well, which was very odd, but it felt like a go-kart.
Suzanne knows she's been lucky and that the air ambulance made all the difference.
Outside leg.
Got off really lightly. I just remember voices, and I just love to be able to put faces to the voices and just say thank you very much for rescuing me.